Welcome to my final project. My name is Jennifer Sleeman. My topic today is acute kidney failure, and we will be exploring the supplements of ginger and glucosamine. I chose this topic since my dog was diagnosed with kidney failure. I have complemented his conventional treatment with herbal supplements. He is a 13-year-old rescue dog who spent the first weekend with me at the vet hospital for severe vomiting and malaise. Nearly 6 months later, he is a happy, thriving dog. Please remember, supplemental therapies are not designed to take the place of treatment by a physician. Kidneys remove waste from blood and assist with electrolyte balance of sodium, potassium, and calcium. In addition, kidneys assist with the maintenance of blood pressure. In a time period of about an hour, kidneys typically process around 120 pints of blood. The term acute kidney injury replaced the term of acute kidney failure in 2007. Diagnosis is made by the evaluation of blood serum markers such as creatine, and also the reduced elimination of urine. The incidence of acute kidney injury is rising. The condition may be the result of aging from chronic disease, dehydration, supplement toxicity, or idiopathic. NSAIDs, also known as anti-inflammatory pain relievers, are believed to contribute to the onset of acute kidney injury as well. Approximately 1 in 10 people have the onset of chronic kidney disease in the U.S. People with chronic kidney disease are 10 times more likely to die prematurely before dialysis even becomes necessary. The World Health Organization estimates that 1 to 5% of the global population passed away from chronic kidney disease in 2012. Low-income individuals are 60% more likely to have advanced kidney disease. Should serum tests reveal more than 150 milligrams of protein, lost daily in urine, reduced kidney function should be suspected. Findings of urine sediment could also point to a diagnosis of kidney disease. Those with kidney disease should avoid supplements containing phosphates. Symptoms of AKI could include hypertension, shortness of breath, cramping, cognitive impairment. In some cases, that cognitive impairment could be as high as 65%. Vomiting may be present. The person may experience frothy urine or reduced urine output. Also, pockets of edema could present. The term AKI doesn't necessarily refer to the severity of the case, but rather to the quickness of the onset. Conventional treatment typically continues until kidney function is restored. IVs, potassium reductions, or calcium infusions may be necessary. In severe cases, dialysis may be needed. The costs for patients visiting the hospital with AKI were higher than the costs for heart attacks or GI bleeding. The hospital costs of AKI were roughly equal to the hospital stays for pancreatitis, strokes, or pneumonia. AKI results in healthcare costs upwards of $10 billion annually. Dialysis patients have increased by 400% in the last 20 years. Nearly half of all Americans take over-the-counter supplements. Many healthcare practitioners do not inquire about possible patient supplements. Approximately 15 million Americans combine prescription use with supplements. Although supplements are not reviewed by the FDA before being placed on the market, 46% of supplement users believe the products on the market have a verified safety record. Fillers and additives in supplements may further impair renal function. Heavy metals or synthetic drugs, such as pain relievers, may also negatively affect renal function. Here are a list of supplements that have an effect on renal function. It's not only ingestion that can create ill effects from high levels of supplementation. Topicals can add to blood serum levels as well. A study reviewed dialysis patients and found blood serum levels of vitamin A to be around 15,000 IU, which is well over the 5,000 IU suggested daily. Ginger has been taken to reduce the symptoms of nausea, vomiting, dizziness, and pain. In addition, ginger has been used to treat patients with difficulty swallowing and taken to relieve symptoms of a hangover. Adverse reactions may be experienced if ginger is combined with medications that affect blood clotting and blood sugar. Over 1.8 million tons of ginger are consumed annually all over the globe. Ginger may reduce the inflammation response by limiting the production of nitric oxide and pro-inflammatory markers. The ginger metabolite has been found to reduce inflammation in animal studies of stroke and dementia. This study explored the ginger metabolite's action on inflammation and kidney tubular death. Columbia University conducted an experiment on mice with the control group. Key identifiers of kidney injury were measured: blood plasma urea nitrogen, creatine, and neutrophil gelatinase-associated lipocalin, mRNA. NGAL is used to assess tubular damage. Neutrophils readily respond to AKI and are the cause of renal tubular cell death. Mice treated with the ginger metabolite had lower creatine levels, lower BUN levels, and lower NGAL levels. Less renal tubular death was present in the mice treated with the ginger metabolite. While further studies are necessary, ginger may have benefits if it is used as a preventative measure for AKI associated with operative procedures. In Table 1, both ginger and AG showed beneficial results when administered with adenine. Serum creatine, urea, and BUN were lower after treatment. In Table 2, both ginger and AG were able to lower LDH. However, adenine increased the rate of lipid peroxidation and inflammation. Adenine negatively affected renal function. Oral ingestion of adenine and ginger increased kidney function. The study found that kidney dysfunction created by adenine was most improved when ginger was ingested. Adenine affected renal function by destroying microvilli in the proximal tube and reduced cell electrolytes and mitochondria. The loss of mitochondria caused the sodium-potassium adenosine triphosphate pump process to be disrupted. Ginger administration allowed proximal tubule function to continue normally. Zingerin has shown positive results in animal studies with heart attacks, irritable bowel disorder, and to reduce lung and liver inflammation. Its action affects certain signaling pathways. AKI presents with increased level of inflammatory markers. Ginger given at 10 milligrams per kilogram or 20 milligrams per kilogram or 40 milligrams per kilogram could reduce the presentation of AKI inflammation. Glucosamine is commonly taken to alleviate the symptoms of arthritis. Glucosamine should be avoided by someone who has an allergy to shellfish. It should be used with caution in patients who have asthma, liver disease, high cholesterol, diabetes, or cancer. Dysfunction of the proximal tubules are often seen in cases of AKI. A glucosamine derivative, TPG, helped maintain renal function. In this study, AKI was created in rats by clamping various structures in the renal area. Oxidative stress, pro-inflammatory markers, and intracellular adhesion markers were studied. Neutrophils are called to the scene after AKI and create inflammatory and pro-fibrogenic evidence. TPG prevented the function leading to oxidative stress after AKI. In addition, TPG lessened the presentation of reactive oxygen species. AKI results from activation of the proteotoxic stress response. Prior studies have concluded that the administration of amino sugars has facilitated recovery in animal retina and heart injury studies. O-linked coupling of N-acetylglucosamine may increase the survival rate associated with AKI. This oral glucosamine product that was tested in this particular study is an over-the-counter product. This O-linked coupling in hypovolemic cardiogenic shock has been found to lessen heart inflammation and afford a better recovery. However, in diabetic patients, this O-linked coupling leads to mitochondria dysfunction. The study concluded that calorie reduction appears to benefit AKI more greatly, while the O-linked coupling supplement of N-acetylglucosamine offers no significant benefit. Coronary angiography causes AKI at a ratio of 2 to 50% of all surgical patients. O-GLC-NAC may increase due to stress, and high levels may coexist in cases of cancer, diabetes, and along with some types of nerve damage. In this study, the AKI was instituted in rats, so they presented with vacuole degeneration, along with damage and death to renal tubular epithelial cells. This study also theorizes that AKI is caused by an interplay of multiple factors, such as medullary death, reactive oxygen species, and direct tubular cell toxicity. The prior study found glucosamine ineffective, while this study feels that it could be beneficial. The formula for glucosamine differed between the two studies. Also, the mechanism of causation was different between Study 2 and Study 3. Study 2 looked at the chemical composition similar to an over-the-counter product, while Study 3 examined a supplement to be given in a clinical setting. Comparing the two studies is interesting because it highlights success or failure of a supplement can hinge on the chemical formula used. When we look at over-the-counter supplements, often there are conflicting messages, some successes, some failures. It's difficult to compare studies and results if the protocol varies from study to study, the subjects vary, and the underlying premises on which the study is based are also different. Accordingly, the glucosamine results are mixed. Thank you for listening to my presentation. And as we summarize, a few takeaways are as follows. Some supplements may impair renal function. Topical vitamin A combined with ingestion could reach toxicity levels and impair renal function. AKI is diagnosed based on blood serum markers and refers to a rapid onset, not the severity of the case. Cases of AKI are on the rise. AKI onset may not be recognized until symptoms become severe. Studies have been performed on animals. Human trials would need to confirm study results. And ginger seems to be more promising than the glucosamine supplement.